Hi, this video is the art of hair transplant restoration surgery result with 1 year post-op with before and after photo by Dr. Diep, and on this Caucasian man who has a receding hairline and a frontal hair loss, around class 3 hair loss. And we'll be attempting at least 2,000 grafts because his hair is very fine, and the reinforcement is not just below the hairline filling the bald spot, but we got to go toward the back for reinforcement to anticipate the future hair loss. So with that in mind, it looks like it might need more than 2,000 grafts, but we don't know until we do the surgery, but at least 2,000. The thicker the hair, the less you need to cover the same area versus the thinner the hair. Hair transplant, especially the hairline recreation, is an art form, requiring a lot of the artistic and aesthetic detail to ensure a very natural result. From the mid-eyebrow to the hairline, on average, it's around 7.5 to 8.5 for Caucasian men. For Asian and Black, around 6.5 to 7. Other ethnicity vary from 7 to 7.5. For this client, actually, it's around 7.25. Again, we use the average height of each ethnic hairline to guide, but when we build the hairline, we want to build it according to each individual facial structure to ensure each person has her own unique hairline, as long as proportional to the overall face. Once we get the shape down, we will transplant once we get the height down, then the more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline is. And then the line is an imaginary line. It's just a median because we're really dancing up and down the hairline. Once we get the shape down, we transplant at a very precise angle, 35-45 in the front, increases when you go backward, and changes when you go different direction. Selection of hair graft is very important. We transplant rows and rows of single hair graft in the front, followed by a group to go 2 hair, 3 hair, and 4 hair in the back for both in volume. And this is a few meticulous details that I explained, but there's quite a bit more. But when you pay attention to all the details and take in consideration of the whole artistry of the face and make sure it's proportional and even on both sides, the hair result going to be very natural. At least with my work, there will be not much detectability. And it'll be, when you walk down the street, no one will know you have had any surgery done. And with this client using the FUE, he has an option to shave his head shorter because the scar of the FUE is quite a bit smaller. So this is the art of a hair transplant on a client with a class 3 hair loss pattern, 3A with frontal hair loss. And we not only the hairline, recreate the hairline, but building the frontal area and reinforce the back. Thank you.